suburb of the emergency?
I was mental health.
Okay, what's your name?
Tara.
Tara, take a nice deep breath. Tell me exactly what's happened.
My husband's sitting on the floor.
Okay, Tara, listen to me. So I'm going to ask you some questions so we can get some help coming out.
I'm sitting. I need help.
Tara,
Yes.
listen to me. Don't touch him. Don't hold him down or put anything into his mouth. Do you understand?
Okay.
Is he awake? Tara?
He's sitting.
Tara, listen to me. Is he awake?
Yes, he's probably.
Okay, Tara, is he breathing?
He's sitting.
Tara?
Tonight, a surprising diagnosis.
Have you got any medical conditions?
Yeah, bad.
Okay, that's a pretty bad one, isn't it?
A fallen rider, feeling no pain. A child in trouble.
Every paramedic dreads a paediatric case.
So she fell from the seat to the floor, was it?
As paramedics go above and beyond to help.
Is that what you have your tequila in?
Exclusive access from the operations centre
He's not breathing.
Stay on the line, I'll tell you exactly what to do next.
to the paramedics on the front line,
5 people have been stabbed.
fighting to save lives. These are the stories behind the lights and sirens of Queensland Ambulance.
Tara, is he breathing? Tara, listen to me. Is he breathing?
Yes.
Okay. Now, Tara, listen to my voice. The ambulance is coming out as quickly as it can. I need you to stay calm so we can help him. Has the twitching stopped yet?
Yes, he's sitting up. But
Okay, Tara, get him down on the ground.
I've got my neighbour trying to get him
Yep,
around.
all right.
My neighbour thinks he's being electrocuted. He's got a power cable around his body. Yes.
Where is the cord?
It was wrapped around his chest.
Okay, I need, Tara, listen to me. I need you to go out and turn the power off immediately.
Can you stop that, please?
Hello, ambulance.
Hello, who is this?
Christian, the next door neighbour.
Okay, is the power off?
Oh, I'm going to have a look at the electric car's power box.
Can you do that for me now, please?
It's off now.
It's off now?
I've just switched it off.
Yep, no, that's perfect. Christian, can you go back to the patient for me?
Yeah, he's okay. Yeah.
Okay, what's he doing?
He's breathing heavily.
Yep.
He cut the bruises on him from falling over, I think.
Now, you let me know if he becomes less awake at all, okay?
You want both? Open your eyes. Stay close. He's just touching the left side of his chest.
He's clutching his chest?
Yeah.
Okay. Okay, sit him down for me.
Yeah.
And I want you just to keep him resting. Now, does he have any open wounds?
He's got a couple of cuts on his pants.
All right, so help is coming out as quickly as it can,
His speech is
okay?
slurred?
His
Yeah.
speech is slurred? All right, keep him resting for me comfortably, okay? Now, if he becomes less awake and vomits, I need you to quickly turn him on his side.
Yeah. So like his speech is... I'm sorry for that.
No, that's okay, understandable. Are there any burns to his body?
There's red marks all over him, so yeah, kind of.
Okay, so Christian, what I'd like you to do with the burns to his body is I'd like you to use some clean, cool water just out of a tap, and I want you just to pour that over the burns, okay? And we're just going to cool that area down. Does he have any recollection of the event?
Sorry, do you know what happened? Do you have any recollection? No, he's got nothing.
So you think this...
Down, brother. Down.
Yeah, keep him. Look, he is going to be pretty disorientated, but we really want him to just stay seated. How's Tara going? Is she okay?
Yeah, she's
Yeah.
washing it with her hands with the cold.
Okay, perfect. All right, she's done really well. It would have been very scary for her to find him like that, so we'll definitely check her over when we get there too, okay?
Yeah.
Very stressful. You've done really, really well.
Here they are. Looks like there's another one coming.
Yeah, you've got 2 ambulances on the way.
Okay, so ambulance, yeah.
All right, I'm going to let you go, Christian, okay? Fantastic job. All right, mate, all the best. Okay, bye-bye. her husband, and she said he's having a seizure. And then on closer inspection, he had an electrical wire wrapped around his chest, so he was being electrocuted. If she had touched him, she would have been electrocuted as well, so it just could have been, oh God. You don't get those calls, obviously, very often, and when you do, it just the adrenaline just boots into overdrive. Yeah, I don't need any more coffee. I'm good now.
It's 11 a.m. and husband and wife team Andrew and Jan are starting their 12-hour shift on the road.
What do you want me to do with the cheesecake, Andrew?
Sorry?
What do you want me to do with the cheesecake? In the fridge?
Yeah. Oh, could be none left by the time we get back.
That's what I mean.
Yeah, no, let's bring it with us so we can bloody...
All right.
Yeah.
Cool, I got a lid.
It might even fit in this
Will it fit in there?
Maybe it won't.
Andrew and I have known each other for 9 years, and we've been together for maybe 7. That'll be the white chocolate Tim Tam, so you got to get that bit. Before we were even a couple, he baked me white chocolate Tim Tam cheesecake, and I sort of got an inkling that maybe he sort of liked me. Ian's asked if he can please be your wife because he loves that.
Yeah, no worries.
Would you like me to get your bag and pop it on, Andrew?
Oh, yes, please.
Feeding her white chocolate cheesecake in the front seat of my car, I think that did the trick. She realised I can cook.
And the cookies and our coffee cup.
Yeah, anything you want to throw in that you think we might need.
I mean, it turns out she likes balding older men.
Thanks.
My pleasure, darling.
North of Brisbane, emergency services have been alerted to a patient having a psychotic episode at a public boat ramp. One police unit is already on scene. A second is en route. Andrew and Jan in car 238 are 10 minutes away.
So what are we actually going to?
Late 30s, stating that people are trying to kill him. Possibly a mental health breakdown. Police are on scene. Do you remember the guy we went to when I was a student? I reckon I must have had one stripe around that time.
Oh, you were like a deer in the headlights.
Oh, it was great.
Eyes were as big as dinner plates.
And I remember you saying, what do you want to do? And I was just like, I don't know. Because I think mental health is kind of thing you can't really be taught much. It's all about learning by feel and experience. He says people are trying to kill him, and we have been upgraded because he's now unconscious. The fact that he's unconscious is worrying, because it would suggest there's some sort of drug or alcohol involved.
You don't often go to patients that are purely paranoid or delusional. It's usually accompanied with some sort of substance as well.
We're here.
North of Brisbane, paramedics Andrew and Jan have been called to a patient having a psychotic episode at a boat ramp. Due to public safety concerns, 2 police units are already on scene.
I think they're actually holding him down now. He's not unconscious.
The man has been handcuffed for safety.
I might just go and have a chat.
Yeah, okay, yeah.
Hello. Obviously not unconscious anymore. My name's Jan.
It's from the handcuffs. I'm not going to say it's shutdown. My ribcage, my heart, and my lung. It's water pumping in. I'm telling you to do it now before I run out of time. When we pull up, he's just erratic, like super strong and just...
Somebody ring you?
Yeah, he's really aggressive.
Have you had any drugs or alcohol today?
No, I can't breathe, I don't eat.
Okay. Where do you live?
Right here.
Right here? You got any family or anything nearby?
No, I'm dead.
No, you're dead, are you? Okay.
Yeah, you did say it's meth earlier.
Oh, you had some meth? Okay, no worries. Do you have meth pretty regularly?
Well, we'll be after the tickets job taken.
When you have patients that are affected by ice, they're incredibly unpredictable. They can become incredibly strong. But you can have a patient that is quite small that requires 6 police officers to restrain them, and it's still unsafe.
Is it all right if I do your blood sugars and just see if your blood sugars are okay?
It'll be 0.
Okay. There's going to be a little sharp prick in your finger, is that all right?
Yeah, but that's really...
Okay, good-o. All right, thank you. All right. Have you got any medical conditions?
Yeah, I'm dead.
Okay, that's a pretty bad one, isn't it? So what I'm going to do, we're going to take you to the hospital, and they can pronounce you dead there. Hey, how's that sound?
I need to do it here.
I can't do it here. I can't get a doctor out
$1
here.
million to do it here.
Have you got $1 million? Oh, my
I'm in the
God.
briefcase looking at you now.
Where's the briefcase? Quick, let's get that and go.
Oh, little briefcase.
All right, can we get you on that? Hang on, let me just get the bed down for you. Thank you. We're just going to get him up, chuck him on, and just see how he goes. That's the way. No, it's all right. Maybe down a little bit further.
That's a little stupid.
Bum up here a bit. Just trying to get this bum down there. That's it. Good job. You're right there. Do you want to sit up a little bit, or you're okay?
No.
All right. The patient's telling me that he's dead, and so if you can make light of the situation, have a smile with the police, that is what it takes to get you through that job.
You're going to lose the job, and that nigga's going to lose the job, and that lady's going to give you a paperwork and piss in the feet. I'm dead. I'm done.
Oh, you
Take that machine on me. I bet there's nothing.
I will, all right? I'm gonna take your blood pressure, okay? So can I...
There isn't any. What's the no pulse?
No pulse?
Oh, look, maybe she worked the first time. Look at that, no pulse.
I can feel your pulse in your wrist.
That's the water bottle with the little water pump keeping my body going.
Ah, okay.
Dealing with patients that are suffering delusions either through some sort of psychotic mental health problem or drug-induced can be incredibly complicated.
I'm gonna pop some dots on you, okay?
Because often they generally believe that what is going on is true.
Chop my whole chest, I'll give you 100 grand through the door.
What am I going to do? What am I going to do?
I'll give you 100 grand.
That would be very messy.
No,
It would be. Good to go?
I swear to God, I'll give you 100 grand, we'll turn around and get the blood for you.
Yeah, just tell my offside I'm going to the hospital. Yeah,
Thank you.
Open the back for it. Bye-bye, dickhead.
In some cases, I liken it to if you put a cat inside a cage and shake it, what that cat's going to come out like. That's what we have to deal with a patient that's ice affected.
I got your ECG. Does that count?
Yeah.
It actually looks pretty good.
Says I'm dead.
No, you see those little bits that go up and down?
Little bits.
That says that your heart's going really well.
Yeah.
It's going a million miles an hour, but it's still going pretty good. Yeah.
With drugs like ice, the effect on the heart can result in significantly shortening their life.
Yeah, you never know, because he has been talking a little bit intermittently between passing away and coming back.
Jan is not just a sound clinician, but also, an empathetic paramedic as well. Is able to not just treat a patient physically, but also be able to emotionally assist them as well.
We're going to go into the hospital.
I'm still going to lay in bed.
Yeah. So I really need you to pretend that you are dead.
Okay.
Because there's going to be sick people in there, okay? So I need you to really pretend to be dead, if you can.
Yeah, I'll be very well.
Okay, there'll be dead people. There is sick people in there, okay?
Can you take your handcuffs off for 50? Last chance to make money and not have a job.
I need two running, mate.
So yeah.
He's a dickhead.
Can you try to be dead for me?
I'm dead, exactly.
Jan?
Yes?
Can you go in and get triaged?
Yes.
They've got a spot sorted for us. So if you just want to go and see a triage nurse and get triaged?
Yep. For me and my experience, drugs in general are just life enders.
How you going? Are you still dead? Mm-hmm. Yeah.
Well, I'm going to get your shoes and put them on the bed, hey? Is that all right? Mm-hmm. All right. Oh, my God, your shoes are all wet. Mm-hmm. You've been walking around in the water?
I'm good.
Oh, yeah, you did. Remember, nice and quiet.
Hey, boys. Tell this idiot to take your handcuffs off.
Good? Let's do it. Couple of bumps. It's the end of your work. It's the end of your school. It's the end of your economic stability. It's the end of your family life. If you're getting into drugs, I promise you there are very few people who come out the other end successfully.
Oh, quick, save a life. Ambulance, what's the town or suburb of the emergency?
One of the ladies has been assaulted and we just need her checked out to make sure that she's okay.
It's afternoon in the operations centre and call takers have been answering emergencies for nearly 8 hours.
Can I just ask you, are you family? No, I'm the lady across the road. She hasn't got family.
He's been standing at the zebra crossing for the last 25 minutes now.
Okay, so I'm on the front.
Made an assumption that he either had some methadone or something recently, so I suspect he's homeless or has mental health.
Are you happy to watch him until we get there? Okay.
Yep.
What kind of car is she sitting in? Some days you lose faith in humanity and the people in it, especially if you're having lots of assaults. Yeah, it's really not a problem at all for us to come and check her out. We want to make sure she's fine after what's happened with her. But then you get calls like that and you're like, oh, there are really good people out there too.
Ambulance, tell me exactly what happened. I have a elderly patient here who has been in hospital a few times with heart. So she's got chest and abdominal pain, is that correct? Yeah. How old is she? 85.
And she's not in the old folks' home, is she?
No, it's a residence.
I hope she's not alone. That's always the most frightening part.
Yeah. One of the biggest problems in an ageing population is that we have an increasing number of older people that are still living in their own homes. If they become socially isolated, then they're at a far greater risk of not being able to get the help that they need, whether they've had a fall or become ill and unable to get to a phone to call for the ambulance.
We'll get it sorted out.
I know, and you charm the ladies, so she'll be very happy.
She's my age bracket.
She is.
85.
Yep.
Hello.
Good morning.
How are you?
Very well, how are you?
Hello. So who are we here for?
We got Shirley here.
Shirley. Hello, Shirley.
Good morning.
My name's Andrew and this is Jan.
Very well, how are you? Hello, Shirley.
So what's happened? Why have we been called today?
I get this pain in my side.
Yeah.
And it's
down quite low, is it?
It's there.
Yeah, okay.
And I've been getting a bit, but then it sort of wears off.
Yep.
But in the early hours this morning, it just hasn't got any better. It's getting worse, I think.
All right. Now, have they found anything yet? Have they said what it is at hospital?
No, well, the whole it's a big long story.
Do I need to sit down?
You probably need
Do we need a cup of tea?
One of my favourite things about this job is to be able to really connect with patients. And I think that's something that is a strength of mine, is being able to pretty quickly identify what I can say to this patient to develop a little bit of a bond.
All right. Now, have you got any pain in your chest?
No.
No. And you've had any pain in your chest?
I never do.
No. Okay. So when you've had heart attacks before, you haven't had any pain here? Okay. What symptoms did you have with your heart attacks?
I get out of breath.
Yeah. Do you get sweaty?
Sometimes, but not a lot.
Okay.
Not necessarily.
Do you feel like you're breathing okay at the moment? Not really?
I think as we get older, continuing to be independent is such an important thing for our own mental health and our own feeling of self-worth. If you can do something for yourself or for other people, you continue to feel like you have a place in this world and there's a reason for you to be around.
Yeah, okay. Because you are in atrial fibrillation at the moment. Yeah, so that might account for why your breathing's not the best. Now, Shirley, what do you like on your feet normally?
I'm normally pretty good.
Yeah?
But this morning, I was so unsure. I took my walker when I went through.
Because you're unsteady or weak?
Yeah, because, I'm frightened.
Yeah, okay. All right. Well, you don't have to be frightened now because we're here.
Yeah, that's what we got you for.
That's right.
She's just gone to have a look to see.
They're up in her office where she was looking.
Does she live with you?
No, she's just a lovely friend.
Oh, beautiful. Did you give her a ring this morning?
Yeah, she's been calling in on the way to and from work.
Because your son's in hospital at the moment, she said.
Yes.
Is he unwell?
Well, they think he's had a heart attack too.
Oh, jeepers. When did he go in hospital?
Not yesterday, the day before.
Oh, so just recent.
Well, let's stitch up so you can have some medication. Is that what you have your tequila in?
I really, really enjoy going to elderly people because elderly people are very smart and they're very crafty and they're very funny. It can be the joy of my day.
I'll come down and see you and bring you some stuff. Thank you, darling. Thank you. And I'll make sure. No, don't be silly. It's all right.
That's it. You okay? You pay good money for her, don't you?
Yeah.
Top dollar?
The bill's in the mail. She's worth more.
Yeah, it's nice. Good to have friends, isn't it?
Whenever we have a job where we have a concerned relative or close friend or neighbour showing genuine concern for a patient, it does remind you that there's just a lot of really good people out there that are happy to help.
See you, darling. I'll see you later on. Thank you, Natalie.
All right, tell them to call me if there's any drama.
Thanks for your help.
Thanks.
Now, I like to think I'm funny. Some people don't. So it doesn't always work, but that's where you need to be able to adjust the way you're dealing with people as you go.
I like rum. You know what the problem with rum, though, is? My clothes fall off when I drink too much. They just fall off. I've never understood why, but it just happens.
Well, you should take that up as a study.
A study? Do you think you're going to get some government funding for
Are
that?
you telling her about your clothes falling off?
Shirley reckons I should get some government funding to study why my clothes fall off when I drink rum.
You could be onto something, Shirley. Yeah. A couple of bumps on the way out.
I think we'll invite you back, Shirley.
We see so many things on the news with people doing horrible things to each other. Yet just in these communities you have someone, whether they may not have necessarily been a neighbour for a long time, but they see someone who needs help and they quite happily put someone's shopping in their fridge for them or make sure their bike gets taken home once they've had an accident or whatever.
Oh, darling, here we go.
It truly does rekindle hope for humanity, I guess.
Ambulance, was it town or suburb of the emergency?
It's up in Mount Combat. There's a motorbike accident in front of my house.
We're just watching TV and we heard a hell of a smash and there's a person on the road now.
I've had to stop. There's a gentleman fallen off the motorbike and he's in a lot of pain.
Okay, would that be nearabouts Dawson Road?
Yeah, that's right.
Okay, looks like we do have a call for that. I'll just confirm a few details with you. Just one moment.
It's 4 p.m. and multiple calls about a motorbike crash are flooding in.
So was it just him by himself that he had the accident?
He's by himself or accident? It's a car and a bike, but what's it?
Is there any serious bleeding?
Oh, I don't know.
Okay, are you with him now? Yes. Are there chemicals or other hazards involved? Motorbike has some fuel leaking. Okay. We'll probably need the police here. We're redirecting traffic as well.
In the Brisbane Operations Centre,
Are you with him now? Yes.
multiple emergency calls are reporting a motorbike which has crashed into a moving car on a suburban street.
Are there chemicals or other hazards involved? Motorbike has some fuel leaking. Okay.
Well, help's been arranged. Advise any bystanders to stand well clear of approaching traffic. Now, if it gets worse in any way, just give us a call back immediately on 000 for further instructions, okay?
All right.
Thank you.
Yeah, all right. Thank you so much.
Code 1 to Upper Mount to Combat. Thanks for being back. Coffee motorbike.
So it looks like we've been called to a car versus motorbike. Seems that the motorcyclist is still lying on the road. There's been a lot of calls come in about this, so generally there's a lot of calls that can usually mean it's probably quite serious.
Because of the nature of the crash, 2 ambulances, a critical care paramedic, as well as fire and police are dispatched. Dan in car 292 is 5 minutes away.
Motorbike RTCs always have a very high suspicion for very bad injury, even at the lower speeds. There's nothing between them and the road that's saving them.
The rider has a severely injured left leg.
Hey guys.
With multiple services on scene, Dan's job is to manage the site.
Car over there is kind of going to slide off. As long as we're complaining of leg pain at the moment.
Yep.
We scores at the moment, see what's going on, please. Send out ways uncomfortable.
Yeah, okay.
I'll get them on board as Clemson.
Perfect, thank you. Where was the other car? Oh, the other side? And are they all right?
No, the other crew's taken on there.
All right, cool. I'll just go have a quick look over there.
An important part of assessing motorbike crashes is looking at the damage of cars, motorbikes, helmets. We can really start to paint a picture of the velocity that this occurred at and the potential damage that that person has done to themselves.
Yep.
The white car.
Okay.
And you've already seen the motorbike?
Yeah, certainly. No injuries here, just...
He's just got a scratch on his arm. Yeah.
Okay.
Discussing potentially going up if he wants to get checked out. That's
all right.
Okay, well done, mate. Good job.
292, just confirming that police are now on scene as well. We have got one lane of the road blocked here, so currently fireys are directing traffic.
Roger. 0505 direct.
I'm just going to put his helmet behind the seat. There's not much to it, but just for you guys.
Yeah.
0505 292.
292.
Just advising the male motorcycle rider has got a very obvious left mid-shaft femur fracture, so they're just dealing with that now.
Copy that, 292.
The crash has fractured the man's left femur or thigh bone.
That's all there, won't push it?
Yeah. Literally above the knees, up to, yeah.
The longest bone in the body, it needs to be stabilised in a splint before he can be moved.
Just going to have a strap up around in your crutch there, all right? You all right?
Hear the sound of drums.
It's gonna hurt, mate. Kneeling down.
All right. Slightly easier, bit better position.
Yeah, it feels better already.
Right.
You help me up, I'm just going to hobble over.
Mate, I'm just going to press in.
Yeah, you're right. I can feel it. It's cool.
That's okay?
Yep.
Sorry. That's right. Can you cross that one across your chest for me? Yep.
It always catches you by surprise when you've got someone with quite a significant injury that then starts to just sing or whistle. It certainly lightens the mood up a little bit.
Yeah. Just going to move the board out from underneath you, okay? Keep that head there.
Before you take me away though, right?
Yeah.
Could you maybe, if there's a homeowner somewhere here standing around?
Yep. We might do the
could
police.
possibly just say, did anyone push this bloke in here for a couple of days, you know what I mean? Can someone just throw that there, you just throw it to someone behind you?
Yeah, we might have a chat.
Just say that...
When the police will pop in, we might get them to ask those questions.
Yeah, I just can't afford to have it taken away in a tow truck, you know?
Yeah.
Excuse me, mate. If there's any chance you can push my bike into your yard for a couple of days or on the grass, that'd help me. But it's okay if you can't, thank you.
Can you make sure the guy that I hit in the car, can you give him my name and number so that he can tell his insurance company to ring me?
All the best, hey?
Yeah, thanks, mate.
0505 292, yeah, so as you would have seen, the first patient's been taken off the PA for precautions just due to mechanism. Second patient about to transport now.
One of the best things about being a paramedic and doing this job, it's the bystanders that stop in the middle of their day to help someone else. It's also the patients that are absolutely struggling but putting on a brave face. It's those kind of people you come across in this job that inspire you and enrich you and really make you feel good about the world.
In Brisbane, paramedics across the city are starting the night shift.
QAS Sierra 505413. We're going to head down to Chermside, Henry Street case. Thanks.
All right, here we go. Last night shift.
Thanks, 1147.
So it begins. Can I have the keys, please?
of a Gatorade for yesterday, isn't it?
I opened it, put it in my mouth, didn't like it, put it back in for you. That was yesterday. The germs are dead, Shane. Oh, I'm sorry about it.
Ambulance, what is the town or suburb of the emergency? So we've just got a patient in the venue that decided to do a backflip while he was dancing and he landed on his face.
Someone just had a head-on.
Okay.
Three. I think so. He's a bit shocked, though.
Yeah.
It hit him pretty hard.
Ambulance, tell me exactly what happened.
So my daughter was having dinner. She stood up and then it seems like she fell and then hit her head.
Is she awake?
She might be having a fit right now.
Any seizure following an impact to the head is considered a serious emergency.
3-year-old female has had a fall, hit her head, and had a seizure.
Yeah.
So
there's high potential for another seizure.
yeah, these jobs are always difficult because you've not only got the child to look after,
You got the family.
you've got the family there as well. It can be quite a hectic and stressful scene, can't it?
Yeah.
Every paramedic dreads a paediatric case. Not only because of the emotional drama, it's also a whole different set of skills that are required to deal with paediatrics. Their anatomy is smaller, their airways are different. It's more difficult to get IV access. It's just a whole new ball game, to be honest.
Oh, bus driver didn't want to stop first,
Neither
did he?
did that car. Rude.
A child that suffers a head injury and then has a seizure is a massive red flag for us. There's obviously something really significantly wrong going on inside their brain.
Hello. Hello, so what's happened? She feels warm.
Yeah.
What happened, folks?
We were having dinner. So she was eating first.
Yeah.
And then I think she might have stood up to watch the TV, and she fell.
Yep.
Head down. I don't think I didn't see her break her fall. Yeah, I was too late to catch her.
Alrighty. What's her name?
Laura.
Sorry?
Laura.
Laura. Laura. Laura. Wakey, wakey. Wakey, wakey. Hello.
When you see a kid who's not responding appropriately, she looks very lethargic, you're pretty concerned that could be a pretty sick kid.
Initially, she was fine, and she
Fell and then she was still okay?
Yeah, she started choking a bit on her food,
Yeah.
but after a while she settled and she seemed okay, and then moving slower, and then eventually not responding to us.
Alrighty.
Yeah.
It's so important for us to get an accurate history of what occurred. We really do rely on parents to help us in these situations.
So she fell from the seat to the floor,
No,
was it?
she was on the chair. And then
On the chair.
She stood up and she fell.
Is that concrete or tile there?
Tile.
Did you see how she landed?
Yeah, she was like on her head.
On her head. On the front or the back?
Front.
On the front. Okay. So what sort of time frame between the fall and the seizure?
About between 30 to 45 minutes.
30 to 45 minutes.
Yeah.
So she been well recently?
She has a bit of runny nose, which just started.
Well, she does have quite a high temperature at the moment. She's 38.6. And she's had a history of febrile convulsions in the past?
Yeah.
Febrile convulsions are caused by a sudden spike in a child's body temperature. Shane needs to confirm the seizure was caused by Laura's fever and not the knock to the head.
When was the last time she had a febrile convulsion?
Okay, about 6 months.
Alrighty. She's got such a high temperature, she probably feels cold, and that's why she's shaking. So I'm thinking that probably the seizure was unrelated to the fall because of the time period.
Right.
And her normal behaviour in between then.
Sure.
So, but it can't be ruled out, so we're going to take her up to the hospital. All right, might look at getting out of here, hey?
It's a big relief when you start to get that history from the family because you think, oh no, she's had a fall. But based on the other things we found, we think her seizures was from the fever she had.
She even opened her eyes up a little bit. I'll just swap seats with you for a second.
Yeah, just come.
Laura. Hello, beautiful. Hello. Mum's right here. Do you want to just talk to her?
Hey.
It's okay. When I see a child in that situation wake up and start to look around and interact, it's always very relieving. It's a great sign. Oh, that's a big cough. Oh, that's a vomit.
And a vomit.
Wow.
And then she had the big vomit.
That was unexpected, wasn't it? I thought you just had a little bit for tea. It's okay. How's that feel? Better to be out than in? And I thought she was sitting up to say hello to me. She just wanted to throw up at me.
It's not the first time you've had that effect on a girl, is it, Shane?
One day she'll have something nice to say about me, eh?
One day, not today.
Shane is like the typical Aussie bloke. Like, he's really old school, but he's got a heart of gold. If I ever needed an ambulance, I would hope that it was nobody except Shane. I'm glad there's paramedics like him.
Hello. You gonna give us a smile yet? You just want to chew your finger.
Very cute. Hey. Do you normally quite chatty? Yes. Yeah. You're like, yes. Oh, yuck. Oh, yeah, that's strawberries.
This is when you remember that you love your job.
No, love my job, Shane. Love you more.
Hello, my father's 85 years old. He's a diabetic. He's got a stent in his heart. We're having dinner, and unfortunately, he doesn't feel like eating, and it's going white. So if someone could come and help us, please. Problem is.
All right, well, let me get some help out. Is he awake?
Yes, he's conscious.
Is he breathing?
Yes, but he's not well. We can see that he's pretending to be okay.
Okay, we're going to get some help out. Is he completely alert?
I can assure you, he's not well. I
No,
can see it.
these are just some standard questions to get the correct help to him.
Yep.
Is he breathing normally?
Do you have an ambulance coming to the restaurant?
Yes, an ambulance
Thank
is
you.
on the way. Please answer the question so we can get help there quicker.
Thank you.
Is he clammy or having cold sweats?
Yes, he is. Yes.
Okay, I'm
He had all
organising
day
help.
with me, and I think it's just too much.
I'm organising help for him now. Just stay on the line. I'll tell you exactly what to do next.
You
Confirming.
had a video this afternoon, and where he had a sore back. Anyway, I can tell my. Yeah, I know. Yeah. Something. Yeah. Well, yeah. You there?
Oh, just a few
I'm
more
his daughter,
things.
Angela.
Yep, Angela. What's your dad's name?
Ricardo.
Thank you. If it gets worse in any way, call us back immediately on 000 for further
Thank you.
instructions.
All
Thank
right.
you.
Thank
Bye-bye.
you. Bye.
That one wore me out.
We have 1C to an 85-year-old male, says he's conscious breathing, history of diabetic with a stent, he's not eating, he's white in colour, query heart attack.
Oh, so he's got all those risk factors there,
He's got tons of risk factors, but what he's actually complaining of, I guess we don't know till we get there. Bad timing though, poor thing's gone for dinner.
Oh, don't go in there, you... Goodness me.
What's happened tonight?
Well, Dad's just not, we gave him Dad's just not, he's gone pale. He's just not feeling very well. And he keeps putting his hand on his heart. So
Does
Dad's
he
got a
speak
stent in his heart.
English?
Yeah, Dad's...
Yeah. Okay, no,
he's
just
worried,
checking.
He's scared.
Yeah, okay. Do you have...
but Dad has had a glass of red wine thing. Sally's his aide.
Yep.
And he's just, I can tell, like, look, he's gone white.
Yeah.
And he's due to have his medication, but we
Okay.
haven't given it to him.
All right. I'm just going to ask him a couple questions as well, if that's okay, and I'll pick your brains again. How do you feel right now? Do you have pain in your chest? Couple stickers. Okay. Whereabouts? In your belly or your chest? Left side? Or tummy? Tummy. Do you feel like you need to vomit? No? You don't feel sick in your stomach? What does it feel like? Is it aching? Is it stabbing? Is it...
Sore.
Just sore. Was he alert the whole time?
Sure is.
Yeah? We're just taking a trace of your heart. Just make sure there's nothing going on with your heart tonight. What do you reckon, boss? For him, there's nothing on this that I'm concerned enough about that we need to quickly load, go, put lights and sirens on. Probably normal for him, but we'll keep an eye on it.
While Ricardo is not having a heart attack,
Thanks, buddy.
he still needs to go to hospital to ascertain the cause of his abdominal pain.
How good does all this food look?
We are going to go to here, okay? But nice and slow, nice and slow.
Make sure he turns the right way. Up higher, up higher.
This way.
Up here, right up here, right up here.
Perfect.
That's it.
We'll keep checking things and...
Alrighty, let's get out of here. It's a bit noisy.
Hey guys, I'm on crutches.
Oh, okay. Well, we'll meet you at the car, okay? He's not pointing to his chest, and I'm going to go through everything again with him.
Come on, hop along.
I was only in the hospital just a week ago.
And what did you do to yourself?
I injured my knee.
Ooh.
Okay, Angelina.
Sore? Do you feel sick? Yes? Like you might vomit? Is it that kind of feeling though? But do you want something for that sick feeling? We have a medicine I can give you to make you feel less queasy. Because I'll tell you what, if you throw up, I guarantee I'll throw up too. I'm so bad with vomit. Okay. Keeping my eye on you. Sorry? Feel.
He's gonna vomit.
He is?
Yeah, so he might vomit back.
Does he have, which is...
He did it, didn't he? He warned you.
And I offered him medicine. He said, I'm okay, I'm okay. I'm really bad with vomit.
Sometimes I think I'm in the wrong job. Last week I ran out into someone's front garden because it hit me by surprise. I didn't know what I was walking into in that house. The whole family had gastro and it was everywhere. Yeah, it gets pretty gross. Too much of the job is spew and poo.
Shane, can you pull over for a sec? We're just power spewing and I can't reach anything. I've got it all over me.
Over.
Sorry, I'm so sorry.
And just, not for me, but unfortunately it's what we signed up for, so you just deal with it.
Oh, sorry. Can you hold this? Is that okay? Can you do that? Perfect. Sorry, red wine vomits straight in my face.
I actually think I'm getting worse. I wasn't this bad when I started.
I'm going to give you a medicine so you don't vomit, okay? We can't all be vomited in the back. It'll be a hot mess.
Got some for you, Sally?
No, I'm okay. It's just...
Yeah, I'm definitely getting worse with time.
It's just part of the job. In the bag, in the bag, in the bag. Are you sure? You got me last time.
Well, you're right about that vomit. Oh, my God. I'm right here.
All right, let's get you inside. That's my least favourite job, Shane. My least favourite.
Well, as unfortunate as it was, I did have to thank him for the entertainment that you provided me through you.
You had a good giggle.
Watching you in the rear view vision mirror. Yeah. But hopefully it's nothing too serious.
Yeah. Bit of an abdo problem.
But on the high note, I've discovered a restaurant I would like to try. I even managed to grab a menu on the way out. So we can have a look at that.
And on a low note, I don't think I can drink red wine anymore. Ever again. Ugh. Yuck.
And it's another on-time finish, I see.
Only 2 hours late.
Yeah. Well, if you want to finish on time, you go and work for Coles or McDonald's.
The nuggets, though. Imagine working at Macca's.
I feel very proud to be a paramedic. It's a job I just love. And I just keep telling people I've been here 15 years and I still love coming to work.
I feel like people call paramedics heroes a lot and think what we do is really incredible. And most paramedics, I think every paramedic would say, oh, it's not true.
We're just ordinary people doing a job that's a little bit different to most other people's. And we all enjoy it, we all love it. It's just the best thing in the world.
I love to feel like I've made a difference in someone's life. And it might be just to hold someone's hand, or it might be just, doing CPR on somebody.
The Queensland Ambulance Service drives more than 40 million kilometres each year.
Home sweet home.
Attending to more than 1 million patients.
Wow.
That was awesome.
That was awesome.
Yeah.
Because every minute of every day...
Ambulance, what is the town or suburb of the emergency?
Someone makes a call for help.
She needs an ambulance.
Okay, I've got the ambulance coming out to you.
Yeah, it's a tough gig. But I wouldn't change it. I wouldn't change it for the world.